As most are aware, the county's stay-at-home order that was first put into place on March 27th is scheduled to expire tonight at midnight. On behalf of my fellow commissioners, we recognize that these past several weeks have been very difficult and challenging for our residents, to say the least. I believe, however, that our early and aggressive efforts prior to a statewide order has made a difference in flattening our curve and protecting our community and medical infrastructure. As our local order comes to an end, Guilford County will come into alignment under the state's stay-at-home order restrictions. As we and the state have both made additional modifications to our respective orders over the past few weeks, the state's executive order and Guilford County's version have become more similar, which in large part has led us to our decision. I've consulted with the local mayors, public health officials, and community leaders on the decision not to extend our local order. And while the decision to allow our local order to expire is not necessarily agreed upon by everyone involved, I believe that the statewide restrictions, along with the guidance provided by state health officials, maintains the existing social distancing and essential travel guidance, and offers reasonable parameters to help further mitigate the spread of the virus in our community. Many critically important factors have been considered as we came to this very difficult decision as to extend or allow our local order to expire. We certainly considered the available COVID-19 data provided by our public health department, Cone Health, and Wake Forest Baptist Medical and High Point. For example, we considered the number of coronavirus tests that have been reported, the number of positive and negative test results, primarily within the Cone Health system, the availability or accessibility of needed supplies, including personal protective equipment and masks that's been touched on this evening, that are necessary for healthcare workers to care for COVID-19 patients. In addition, we considered the number of COVID-19 positive patients as it relates to the available hospital bed capacity as compared to the increased demands related to the coronavirus outbreak. Consideration was also given to the continued economic impact of maintaining a somewhat more restrictive order for an extended period than that of most counties in North Carolina. We could not ignore the many phone calls, emails, text messages, and sometimes face-to-face encounters with so many of our citizens who've been and are continuing to endure the hardships of lost jobs and lost wages as their hours have been cut back. So many people within our communities are suffering severe financial hardship and are deeply concerned about how to pay for basic necessities such as rent, mortgage, car payments, utilities, and food for their families. Not everyone has the benefit of extra savings in the bank or a relative who can provide financial support to take care of those basic needs for an extended period of time. The mental and emotional strain that comes with the constant fears of our business owners who are deeply concerned about how to retain and pay their employees or how to pay the bills so their businesses have a chance of surviving this health crisis cannot be undervalued. The Guilford County Family Justice Center, for example, is seeing a significant increase in service requests since the crisis began. Just this past Monday, 27 individuals walked through those doors needing help. The heightened risks related to domestic violence, sexual assault, elder abuse, substance abuse, and suicide are very real byproducts of this public health crisis and cannot be overlooked as real and significant threats to the long-term health and well-being of our communities. As you can see, making this type of decision on behalf of our citizens cannot be considered in silo to the exclusion of all other contributing factors. For me personally, I've prayed more than I can remember for God's wisdom and guidance with each passing hour of each passing day as we approach these very important decisions that affect hundreds of thousands of lives. It's a humbling place to be at. It's a position where one must call on all available resources at any given time. It's a position where one can never please everyone all the time. That said, I'm honored to be your public servant and take my role and responsibilities very seriously during a time such as this. The transfer to the statewide restrictions at midnight tonight will help us to unify our efforts and those of the majority of North Carolina's counties. It's important to remember that the expiration of the county order is not a return to normal. The county and our municipal partners are still required to enforce the statewide restrictions. Our public health department and emergency management team will still be coordinating the county's response to combating the virus locally. We are obviously still experiencing infection in our community. While our positive tests remain comparatively low, we are still not out of the woods. And for this reason, the state's stay-at-home order is still in place. We still face and will continue to face, until a vaccine can be developed, a virus that spreads through physical contact. It continues to be important that you do everything that you can to minimize the amount of physical contact that you have with other people. We encourage our citizens to continue to follow the measures outlined in the state's order, to only go out for essential purposes such as food, medical care, or to work, and to work from home if at all possible. If you must go out, you should stay at least 6 feet apart from other people at all times, wear masks in public, and wash your hands frequently. Let me remind everyone that this is still not the time to meet and visit with others, including friends and extended family members. And I know that's a very difficult proposition. We must remember that you can continue to spread the virus even if you don't have symptoms. When we reduce the day-to-day contact with others, we reduce the spread of the infection. For those that have questions regarding the transition to the state's order, information can be found at www.nc.gov/COVID-19. That website and the number 211 will be available on the county's website if it's not already. The county will maintain information and resources on that site for questions and compliance concerns. I want to thank my fellow commissioners, municipal partners, and staff for all their hard work, for their ongoing dedication and commitment to combating the coronavirus. I also want to thank the vast majority of our citizens who've been following our stay-at-home measures, and we are grateful for your sacrifices. We hope that you'll continue to be diligent and safe under the state's stay-at-home restrictions as well. Be safe and stay healthy, and God bless you all.